Good day everyone to my classmates and my professor, Miss Valley Stone. I am Maidelyn Generoso and today I will be discussing my topic, which is cosmetic surgery, trends towards body enhancement. I chose this topic because I want to explore more on this branch of medical field since mostly people nowadays choose to undergo different procedures and surgeries to enhance physical features. The notion that physical beauty has always been an important aspect of one's personality and having attractive plus youthful looks will leave a lasting impact or impression on others. Those perceptions and beliefs gave rise to cosmetic surgery. Cosmetic surgery has always been included in the scope of aesthetics and is continuously updating and acquiring new techniques, as well as utilizing the newest equipment in medical field. It involves invasive procedures and techniques to improve one's appearance, and when you say invasive, it pertains to surgery or operation. Well, it may seem that undergoing cosmetic surgery might be simple and totally safe to many. However, research indicates that it poses health risks, it is costly, and medical malpractices can occur. Aesthetic surgical procedure may pose a health hazard to a patient. Risk of getting post-operative complications and hospital-acquired infections are quite high. There are many case studies proving that post-surgical complications and infections are on the rise. For instance, the most common type of hospital-acquired bacteria is the rapidly growing Mycobacterium abscessus. It is a non-tuberculosis bacteria that can grow quickly within 7 days, making it distinct from other classifications which can take several weeks to grow. My sources for that is the author Cusumano and others, 2017. Several sources are known, such as contaminated antiseptic solutions, unsterile surgical instruments, and poor wound aftercare. When you say contaminated antiseptic solutions, these are expired solutions or the person responsible did not bother to check the content. While unsterile surgical instruments, meaning it did not undergo appropriate sterile procedures. While poor wound aftercare, it might be the health worker in charge did not follow or there is a breach in standard protocol in cleaning or dressing the wound. My sources for that is the Groot and Hewitt, 2016. Here is a case report of a 48 years old female presented with abdominal discomfort and pain 1 month after abdominoplasty, or better known as tummy tuck. Tummy tuck is a procedure wherein it removes excess fats in the abdomen. Her first consultation was on January 2016, where she had abdominal lesions and abscesses that were initially treated with incision and drainage. Abdominal lesions are lumps, bumps, or nodules that can grow within any organ wall of a person, and abscesses are fancy word for pus. Incision and drainage, this is a surgical procedure wherein the surgeon would make a cut on the skin and drain the discharge. This is the primary treatment for such diseases or illnesses. So, for the first consultation of the client, it was in January 2016. And then the second consultation after 2 months, the condition of the patient worsened and cultures of Mycobacterium abscessus were identified. Patient was put on antibiotics therapy. She was given amikacin. Amikacin is a type of antibiotic for severe, serious bacterial infection. So consequently, she had her third consultation after a couple of months wherein there is a persistent growth of smaller nodules and lesions. Massive incisions were done via plastic surgery, and she was changed again. Her drug therapy is changed again into clarithromycin, which is a much stronger type of antibiotics. It was only in January 2017 that the patient was released from the therapy. So you see, unexpected circumstances like this can happen, thereby compromising the health status of the client as well as the expenses for the treatment. Post-operative complication is a serious risk that must be considered before undergoing cosmetic procedures. Another thing is the cost of the operation to be done is also an important aspect to consider before cosmetic surgery. There is a wide array of options of aesthetic procedures. However, these two, breast augmentation, also known as breast enlargement, and rhinoplasty, or also known as nose job, are the most popular. For breast augmentation, the baseline initial cost is around $6,335 without the inclusion of other ancillary fees. However, if there would be complications and reoperation, the fees could rise up to $8,266. Um, my source for this are written Smith, Eichhorn, and Ford 2016. It's the same thing for rhinoplasty, in which the cost without the inclusion of anesthesia, operating room, and surgeon's fee would have a baseline of 5,483. So based on this data, the initial expenses for a certain procedure may significantly increase due to unexpected circumstances, like complications or other miscellaneous fees. Medical malpractices are not uncommon and can still occur. Take for the case of a recent of an 18 years old Colorado woman who have gone wrong. It happened in 2019 where she was supposed to have a breast implant procedure. I think this is primarily due to the negligence on anesthesia administration. It was revealed that the doctor and the nurse left the teenager unobserved for 15 minutes right after administering anesthesia. So, the procedure, as a result, the patient is left with permanent brain damage. Eventually, in 2020, the patient succumbed to her own death. It was allegedly claimed that she was given a larger dose than what is required. This was all over the news. It was said that the doctor and the nurse on duty wants to sedate her and to begin the operation right away. Both the surgeon and the nurse license to practice were revoked, and they were charged and sued by the family of the victim. Often the doctors do not act to the best of their patients' interests, inducing them to a treatment though it's not necessary. Overdosing of anesthesia can cause severe brain depression, respiratory failure, and death. My sources are the Journals of Siddiqui and Kim, 2021. In this case, as mentioned, the nurse and doctor are both aware of the possible fatal result but still push through. Medical negligence can cause devastating outcome, and these errors are often irreversible and life-threatening. In conclusion, cosmetic surgery has its benefits, such as improving one's self-esteem and promoting confidence among individuals, but it does not outweigh the risk. However, problems may arise after surgery, particularly complications and infections which may cause irreversible and life-threatening effects. Compromising a normal way of life should never be an option in aesthetic treatment. Each of us are free to choose what we really want, but at the end of the day, it is better to ask ourselves and weigh between the benefits and consequences as well. A person planning to undergo such procedure should consider the outcome associated with it. For my references, I've been mentioning in my slides, they are Cusumano Eltran and the other authors. I want to credit them. It is on their journal, The Rapidly Growing Mycobacterium Infections After Cosmetic Surgery in Medical Tourists, and De Groot, M.A.N. Hewitt, G. 2006, Infections Due to Rapidly Growing Mycobacteria. A huge portion of my presentation, I got it from these two references. And for the news about the Colorado woman, I got it from Fox News, from Ruiz M., a certain reporter, and for the cost and information about breast augmentation and rhinoplasty, I got it from Smith, Eichhorn, and Ford, and from the American Society of Plastic Surgeons. Thank you so much, and that sums up my persuasive oral presentation.